What are key long-acting antiretroviral considerations for migrants and displaced populations? These populations have significant issues related to very often incomplete of lack of history, including genotype, different subtype possibility, and stigma and disclosure. Also, they very often come from the settings where tuberculosis may be more common, so we have to think about drug-drug interactions between long-acting injectables and rifampicin. There is certain promise which we see from the clinical trials performed in people living in unstable conditions, which support choice of long-acting injectables for people who struggle to adhere to their daily oral antiretrovirals, especially to achieve virological suppression. And also we have to remember that majority of people in Europe who come from the Eastern European countries will be infected with A6 variant, which may have different susceptibility to cabotegravir and rilpivirine. And therefore, there is continued need for the real-time studies in migrating and displaced populations.